I'm a pretty active mother of three. I have a full-time job. I love to work out. I'm very, very busy. And one day I was out exercising with my partner and I had some intense pain and I knew something was wrong. So I went home, I realized I had a hernia.
A hernia really basically is a hole in the musculature or the anatomy of the body. Those hernias can occur really anywhere in the body. You can have umbilical hernias and inguinal hernias being the two most common. Umbilical hernias being at the belly button, inguinal hernias being at the groin. Those would be the typical most common. Probably third most common, then after that would probably be incisional hernias. Hernias as a result of a prior surgery. And so typical symptoms can be a bulge or a mass at the area, either belly button or inguinal most commonly, certainly prior surgical site, but also pain and discomfort over that area, especially with physical exertion.
So I was scared, I didn't know what to do, I couldn't exercise, I was afraid to lift my children, you know, weight-bearing things like that. And I went to visit with Dr. Santaella, and from the moment I walked in the door, his staff was just wonderful, inviting, they made me feel comfortable. I sat down and discussed with him what was going on, what caused the hernia, what he could do to fix me, and I just needed that reassurance from him that I could get back to my normal life.
Well, the typical next step is to proceed with a surgical repair, and this is an area where most of our surgery has gone to laparoscopy and robotic surgery. I think the paradigm shift is back to open surgery. We're able to employ a typically mesh repair, and that mesh repair has almost 3 repairs in one. An inner repair, which used to be our classic laparoscopic repair, and then an outer repair. And so it sandwiches that defect in 2 layers of mesh and makes recurrence rates almost unheard of. So in 14 years, we have yet to have a recurrence in any of our inguinal hernias.
I feel better. I don't have the bulge in my body like I did, so I know that I'm better and I'm back to doing all the busy things that keep me a busy mom of 3 and a full-time working mom. And I'm so glad that I had the opportunity to be with Dr. Santaella, for him to be the one to help me get through this.